Okay, we are comparing the sympathetic and parasympathetic nervous system as well as the somatic nervous system. So right off the bat, somatic is a little bit different than the sympathetic and parasympathetic nervous system. This example right here is the somatic nervous system. Somatic is a little bit different because it is completely voluntary, which means you have your body or your mind controls. You are able to control what's going on, specifically with things like skeletal muscle. And so, as far as the neuron goes that leads to it, we have one complete neuron that goes from usually throughout spinal cord, it leads out, and the entire neuron is myelinated. And then it innervates right into the muscle fibers to the specific muscle cells, and it releases, so we have labeled acetylcholine, to an N1 receptor, a nicotinic 1 receptor. And so that's the somatic nervous system. Comparatively, we have the sympathetic and parasympathetic nervous systems, which are part of the autonomic nervous system, which means they're automatically controlled as reactions to environmental factors and things along those lines. And so sympathetic nervous system is your fight or flight nervous system, and it focuses on reacting in a tense or stressful situation, while parasympathetic is the opposite, is your rest and digest nervous system, which helps you when your body is calm and functions properly while you're calm, including improving digestion and slowing down heart rate and things along those lines. And so for both parasympathetic and sympathetic nervous system, they're going to have two neurons. You'll have your preganglionic here and your postganglionic here. And so this is example parasympathetic right here, versus these ones up here are all going to be sympathetic, but each one of them is going to have a pre and post synaptic neuron, except for one sympathetic nervous system example, which goes to the medulla of, it goes to the adrenal medulla here, which kind of functions almost as its own postsynaptic neuron. And so each presynaptic neuron within sympathetic and parasympathetic releases acetylcholine. And acetylcholine is going to bind to the postsynaptic neuron, which each and every one of those also has an N2 receptor, a nicotinic 2 receptor, and all the nicotinic receptors are considered ionotropic. Ionotropic basically just means that they are ligand-gated channels. They open up and they allow sodium to rush into the cell, causing an action potential to occur. So every time a ionotropic receptor is going to be excitatory. And so the differences here are going to be where specifically the pre and post ganglionic cells are going to synapse. And as far as sympathetic, there are a few different spots. You can have the sympathetic chain ganglia where it synapses, or the collateral ganglia, and this kind of depends on where your neuron's going to end up. So as far as the different types of nerves, spinal nerves are specific to leading to specifically skin, so this section down here, skin, arteries, and glands. And so they will synapse in the sympathetic chain ganglia and then go off to either skin, arteries, or glands. And as they reach skin, arteries, or glands, they're going to release norepinephrine, this little green dot. norepinephrine. And as they release that, it will allow a change within those specific tissues. And then as far as sympathetic nerves go, sympathetic nerves focus specifically on the thoracic cavity. So they'll innervate into your heart and into your lungs and allow changes through there. So it would be also, again, through the sympathetic chain ganglia leading to the thoracic cavity. And then splanchnic nerves are nerves that will synapse in the collateral ganglia and lead to the abdominal cavity. And the collateral ganglia specifically is so where splanchnic nerves come from. They form and then go into the collateral ganglia. But for the adrenal medulla, the nerve that leads to the adrenal medulla goes through both the sympathetic chain ganglia and the collateral ganglia and leads to the adrenal medulla without synapsing in either. And it also will release acetylcholine, but within the adrenal medulla there are cells that have nicotinic 2 receptors, which then produce mostly not norepinephrine, but mostly epinephrine, which then is released. So it's about an 80-20 ratio. So mostly epinephrine into the bloodstream, which will then go on to affect a variety of organs. And then comparatively, there's one exception when it comes to the postsynaptic neuron and what neurotransmitters it releases. That one exception is generalized sweat glands. Generalized sweat glands are going to release acetylcholine within the postsynaptic neuron, and it's going to affect an M muscarinic receptor. And muscarinic receptors are mostly parasympathetic nervous system, except for this one exception when it comes to generalized sweat glands. So the majority of sympathetic nervous system is going to release in the postsynaptic neuron norepinephrine, except for the exception, which releases acetylcholine similar to parasympathetic nervous system. So for the majority of parasympathetic nervous system, you're going to have a longer presynaptic neuron that leads to a synapse on the actual tissue that you're affecting. And the parasympathetic nervous system does not innervate into blood vessels for the most of the time, or skin or glands most of the time. So they avoid those, but they do innervate into the thoracic cavity, the abdominal cavity, the pelvis, and affect those organs. And so most of the parasympathetic nervous system originates from the vagus nerve, and that's one of the cranial nerves, cranial nerve 10. And then it also has some sacral origins that lead to your bladder and to your lower digestive tract. But the parasympathetic nervous system also has at its end of its presynaptic neuron has acetylcholine, which then leads to a nicotinic receptor, and its postsynaptic neuron then releases more acetylcholine to be picked up by the muscarinic receptors. And so for both sympathetic and parasympathetic, their presynaptic neuron will be myelinated. Postsynaptic neuron is not myelinated. But for parasympathetic, presynaptic neuron is longer versus sympathetic nervous system. And when it comes to the receptors, there are a few different types of receptors here. As we said, the alpha and beta receptors are subtypes of adrenergic receptors. Adrenergic just means they are receptive to epinephrine, norepinephrine, which are considered adrenaline. So, via adrenergic. adrenaline. And so a general rule is that for both adrenergic receptors and muscarinic receptors, the odd receptors are excitatory and the even receptors are inhibitory. And there's only one exception, that's beta 2 receptors, which increase the production of CAMP, and that is the one exception to that rule from what we have covered. The rest, you have alpha receptors, alpha 1, which favors norepinephrine over epinephrine, increases IP3, which increases calcium intake, which affects your blood vessels, causing them to constrict, and causes your pupils to dilate, which is called mydriasis. And then alpha 2 receptors favor norepinephrine as well, and they decrease cyclic AMP, as explained, that even receptors cause inhibitory effects. Beta 1 and beta 3 also increase CAMP, causing excitatory effects. Beta 1 affects the heart, causes an increase in heart rate, and is both affected by epinephrine and norepinephrine. Then beta 3 favors norepinephrine and increases CAMP production. And so something specified here, the difference between, as we said, nicotinic receptors are ionotropic. They are ligand-gated channels. The alpha, beta, and muscarinic receptors are metabotropic, meaning they are G-protein coupled receptors, or GPCRs. And this just means that they cause a cascade effect within the cell versus opening a direct channel to allow ions to flow. And so when it comes to the M or muscarinic receptors, following the rule, the odds are excitatory and the evens are inhibitory. The odds promote IP3, which causes increase in calcium. And there is that one exception of muscarinic receptors on the sympathetic nervous system, which cause an increase in release of sweat through generalized sweat glands. And then for even muscarinic, you have a decrease in cyclic AMP, causing a decrease in whatever symptoms you are affecting. One final specification I'd like to make is the overarching term for both nicotinic and muscarinic receptors is cholinergic receptors. And this just means that they bind specifically to acetylcholine. So choline, cholinergic receptors. And so that's an overarching term for them, but they are also divided into further categories, as I said. And nicotinic are ionotropic, muscarinic are metabotropic, but also some of your adrenergic receptors are going to be metabotropic as well. So muscarinic receptors are both cholinergic and metabotropic, but nicotinic receptors are cholinergic and ionotropic. And then you have your adrenergic receptors, which include alpha and beta receptors, which are only metabotropic. They're not cholinergic.